Good afternoon, everyone, and welcome to the webinar, Improving Services for Individuals with Genetic Conditions. I'm James O'Leary. I'm the Chief Innovation Officer with Genetic Alliance, and we're very happy to have you with us today. As a reminder, today's webinar is about a project that we're engaged in with a few partner organizations, actually a lot of partner organizations, to try to develop better genetic services for individuals and families. And I'll talk a little bit more about that later, and we also have a guest speaker with us today, Joan Scott, the Chief of the Genetic Services Branch at the Maternal Child Health Bureau at HRSA with us. And she'll give us an overview of kind of the landscape, the importance of this initiative, and what some of the outcomes that we're hoping for are. If you're not familiar with Genetic Alliance, we're a nonprofit organization founded in 1986, originally as the Alliance for Genetic Support Groups. And our mission is to engage individuals, families, and communities to transform health. We're involved in this particular project as part of a cooperative agreement in partnership with the American College of Medical Genetics. That project is called the National Genetics Education and Consumer Network, and is part of the National Coordinating Center for the Regional Genetic Services Collaboratives. So lots of acronyms, but rest assured that the basic premise and point of the call is that we really just want to get your feedback on an initiative that we're involved in to develop a survey to assess gaps and needs for individuals with genetic conditions. So a little bit more about the overarching effort that survey is part of. We're tasked, the National Coordinating Center and GECN, as well as the Regional Genetics Collaboratives funded by HRSA, with really understanding what a regional genetic services model could look like. This model being a new model that will be funded by HRSA, really up in, I think, starting around 2018. So we're conducting a national needs assessment, and we're proposing a framework for that model of regional genetics care centers. Now, the first question everyone always asks is, what is a regional genetics care center? And we don't know yet. That's essentially the goal of this effort, is to really start with data, start with stories, start with interviews and kind of in-person meetings to really get a sense of what could a model look like that will dramatically improve services and access for families. There's a few guiding factors of that framework. We wanted to certainly to align with national and regional needs, looking at what should be a national approach, what should be a regional approach, what are the benefits of a more narrowed down approach, customized approach within specific regions. We certainly want it to be supported by evidence, which is why we're on the call today, to develop better survey tools to find out about the needs of individuals and families. And we really fundamentally want this to increase access to services. What do we mean by genetic services is part of what we're asking, but certainly it's diagnostics, testing, counseling, and also support of individuals and families with genetic conditions, which is a whole range of services. And we also want to find areas where we can make a measurable impact, where we, with the partners at the table, can really change things for individuals and families, and where we're not repeating what's already out there. So to start off today, we want to do a little kind of practice poll. Throughout the call, we'll be doing two types of polls. We'll be asking you to fill out a poll on your screen on the webinar. So if you're logged in online, you can click an answer, and we will then show you all the results of that poll. And the second type of poll we'll be doing is we're going to ask you to use the chat box on the right-hand side of your screen to put in questions, suggestions as we go along, and I'll alert you when to do that. Just so you know, we're going to be focusing on a few questions of the survey for time purposes, but we welcome suggestions on all of the information in the survey. And there are some proposed questions that you can download on the right-hand side of your screen. There's something called handouts, and you can actually download a Word document so you can give us feedback after the call. So with that, it looks like a good number of people have answered the poll, and we can show you some of the results. So it looks like we have a mix today. We have about, I'd say about 35% that are parents or family members or leaders of support and advocacy organizations, a large number of public health professionals, and then a group of other, which I'm guessing are genetics professionals, people in other types of support organizations, etc. So with that, I want to turn this over to Joan Scott to give you a little bit more information about the Health Resources and Services Administration's perspective. Joan?
Thank you. Can you hear me all right, James?
Yes.
Okay, thank you. So thank you, first of all, to Genetic Alliance, Sharon and James, for inviting me to do a few moments, and I will be brief here, to provide some context and background for you to keep in your mind as you're having the dialogue for the rest of this session. Next slide. So taking a step back, you know, what we're all about, in order to really realize the promise of so much that's happening in the world of genetics, it has to get to the individuals and their families. Because otherwise it's just all very interesting, but if we're not really improving outcomes for people, then it becomes an academic exercise only, and we're about trying to improve the lives and the care of individuals. Next slide. And if you stop and think about it, people, next slide, and just, yeah, click through those. People touch genetics at a lot of different stages in their life cycle for a lot of different reasons. It can happen preconception or during pregnancy. It can happen right within the newborn period as part of newborn screening. It may happen in childhood, adolescence, or early adult or adult onset. So people come in and out of the genetic systems world at different points in their life, and sometimes it's a very brief tangential touching point. For example, in prenatal diagnosis or newborn screening, you have tests and everything comes back fine and you go on your way, and you may not even have remembered that you had some kind of genetic screening. Others individuals, the interaction with the genetics world is more prolonged and potentially sustained. If there is either a clinical history or a family history that suggests there's some genetic issues going on that requires further exploration. The next slide. But regardless of when people touch genetics, there's certain things that need to be in place in order to really, really have good genetic services for individuals. So first of all, whatever testing or genetic information that we elicit has to be of value. It has to help improve the care, the treatment of individuals. But secondly, very importantly, there has to be this systems of genetic services. And what do we mean by that? Well, a couple of things have to be in place. We have to have a healthcare system that is thinking about genetics, so as things come up in a person's family history or come up in the way of their medical history, the healthcare providers who are taking care of those individuals should be thinking, maybe I should be thinking about genetics as part of this etiology. So that's one thing that needs to be in place. The second thing that needs to be in place then is actual genetic healthcare providers, genetic specialists, to refer those individuals to look through that family history or that medical history and determine, yes, this may be something genetic or not. And people need to be able to access those genetic services wherever they live. And obviously, we would hope that all these things get paid for. But then there also needs to be a whole system of care for those individuals who are diagnosed with a genetic condition. And sometimes that system of, and so you go back often into the wider healthcare infrastructure. and sometimes that system of care is very condition-specific and is dependent upon the diagnosis, but a lot of it is a broader systems need around supporting individuals who have any kind of special health care need. So when we talk about improving systems for individuals' genetic conditions, and this is going to be some of the dialogue that Sharon and James take you through, is which piece of this should we be honing in on? It's all important. It's all important, and I wish there was funding to support adequately all pieces of that. But what are the major gaps that if we had $1.98, we would want to put that $1.98 to, and what would be the thing that we would want to change? The next slide. So for the past, since 2004, as James alluded to, HRSA has been funding the regional genetic collaboratives, with the National Coordinating Center being at ACMG, and this is the current infrastructure, in collaboration with, the next slide, Genetic Alliance, who has been emphasizing the consumer aspect of it. And the next slide. To provide a sort of a public health perspective on how do we ensure that people get access to genetic service, very broadly defined. And so over the last decade, the regional collaboratives have done, I think, a really exemplary job of building some public health infrastructures at both a national and a regional basis to be looking at some of these gaps in services and developing demonstration projects and data generation about ways to address them. Next slide. But going forward, this isn't 2015, it's not 2004, and so what are the particular gaps in services that, looking forward over the next 5 years in the future, how should we begin to think about these services? Do we continue to do what we've been doing for the past 10 years, or is there some specific gaps in either a service delivery area, a geographic population, or a group of individuals that we can try and move the needle on, and what is that needle that we're trying to move? The next slide. So some of the questions that you maybe get asked today are sort of what are these gaps from the public, that a public health, that HRSA is uniquely positioned to help support. What are the failures in the market that we can potentially step in and help address? Who's not getting genetic services that needs to be? And what's the needle that we're trying to move? And then what will be the outcome if we are able, if we could succeed? What does success look? Again, I wish we could, fund everything that needs to be done, but that is just unrealistic in today's funding climate, and so we have to be really strategic about thinking about what do we want to try and accomplish that would have a really important impact in ensuring that people do get access to genetic services, whether that is defined narrowly or broadly, regardless of where they live in the country. So with that, I will close. I think there's a last contact information. Unfortunately, I'm not going to be able to stay and listen to the dialogue that you have, but I know I will hear about it later from James and Sharon. Please feel free to reach out to me directly if you want, or communicate to me through the Genetic Alliance. So with that, I'll stop, and James and Sharon, I didn't know if you wanted to have any questions now, or just to save all of that for the end as part of your dialogue.
If there are any questions for Joan, you can type them in to the chat box on the right-hand side of the screen. And Joan, do you mind just staying on for another minute?
I will stay on for a minute.
Great, thank you. So while we wait to see if there are questions, I just want to reiterate a couple things that Joan had said. One is that we really, really want your feedback and your partnership in this effort. This is not meant to be a small group of people making decisions on what would be best for genetic services in the nation. This is an engagement process. This is a community effort. And Genetic Alliance really wants to engage our community to help guide the data collection and then also the process of making recommendations to HRSA on what this model could look like. So with that being said, are there any questions? Okay, it doesn't look like there are any questions at this point. If you do have any questions throughout the webinar, you can always type them in. Thank you so much for joining us, Joan. We really appreciate it.
Thank you very much for inviting me.
So we will be going through all the questions in the survey, as I mentioned before, that are proposed, and focusing on certain questions. And I'll alert you when there's an opportunity to answer a poll. I do want to also welcome you to answer the evaluation survey at the end. So if you can't think of any ideas or questions or suggestions on the spot, that is no problem. There'll be an evaluation at the end, and also you can always email us directly after you have a chance to look through some of the draft questions. So don't worry if nothing strikes you now, but something does later. There are plenty of opportunities to participate. Also, we would love your partnership in crafting the survey and then also disseminating the survey in September of this year. We do want to try and get a big enough and representative sample of individuals with genetic conditions, and as we know, there are thousands of genetic conditions, so we really need your help. And we think that this is a very pivotal survey, but you also notice that it is informed by some of the previous surveys that we've done to individuals with genetic conditions, and these questions are very targeted, meaning they're meant to answer questions in what a regional model could look like. So with that, these on my screen are the areas that we're going to be going through, which are the primary portions of the topics of the survey. The first topic area is demographics. So this survey does have a screener question, and that is, has a doctor or other healthcare provider ever told you that you or your child has a genetic condition? And essentially, this is the question to opt into the survey. And that is because this survey is targeted to individuals with genetic conditions. The second section is demographics. We will be collecting basic demographics, both states, so we can look at how answers differ in the different regional areas. Also, the birth year of the affected individual, and when the genetic condition was confirmed, because we all know from our experiences that our interactions with the genetic services model change, our experience and comfort around our condition, also the progression of the condition, all change. So we are trying to collect some data to give a baseline assessment of where people are at in the process. If there are other demographic questions of interest or importance to you or your community that you think are critical, please enter them into the chat box now. And as I said, there'll be plenty of options on the evaluation or to email us directly as well. So I'll give a few seconds on that before we go on to the next slide. Okay, the next section of the survey is about identification of individuals with genetic conditions. We have a lot of data from previous surveys on the diagnostic odyssey. We think this is a very important part of the genetic services system. So the next poll question we have for you is to help us fill out answers to a question, which is, how long was it from when you or your child first started having symptoms till the time of diagnosis? This is a question that we're planning to answer in the survey, but we'd like to get a baseline options to include. If you are a public health professional, please answer this question based upon your experience with individuals and families. If you are a leader of an advocacy organization, you can either answer on behalf of your members, your average experience, or options for length, or based upon your own personal experience. The second question in this section is what or who helped most in finding a diagnosis for yourself or your child? And this is very important because this diagnostic odyssey, there are so many players that touch our experiences and help us along the path. And so we did want to get a sense of who was the most influential for you. Here are some of the options we were considering: the primary care provider, the genetic counselor, the geneticist, online information, a support group, or a clinical trial or study. If there are other people or resources that you think should be options on this list, please enter them into your chat box now. Great. And you will have certainly an option to put these in after the webinar as well. The next identification question that we included is, after genetic testing, what were the biggest questions you have? And because we want this to be a quantitative survey, we would like to put some options, and then certainly an other box. So what are the biggest questions that you think are important around identification of that condition? I will give a little extra time on this question because I know there are some major questions. There are questions about kind of answers and what next, questions about referrals, and also things like coverage and reimbursement.
Great, and we're hearing a lot of those things. Where can I find information, treatment options, and that's exactly what we like to hear from you. Great expectations, how to follow up, impact on health and school. So we'll be sure to summarize all of these, and we'll be sending out the discussion from today, the recording, and then the updated survey draft to the group as well.
Okay, moving on to the next slide. The next topic area that we're covering is about finding services, information, and support. Specifically, one of the questions we're considering is, how do you or did you select you or your child's specialist? And that is a question about whether they're recommended or referred by other providers, online information about the provider, recommended by a support group, or recommended by other parents. This is a really hard process for many families, and there isn't a lot of quality information available. So we're interested if there are other options or any modifications to these options that you would suggest for this question.
Sure. Recommended by patient advocacy groups, health insurance, early intervention staff providers. Oh, that's a question. Are early intervention staff providers? I think that that could be just another option, early intervention.
Absolutely.
Yep. Upon diagnosis, the team. And the team is interesting too. I think a little bit later we have questions about who makes up your team. We want to kind of capture as much information on that as possible.
Great. Okay, moving on to the next question in this area. How do you rank the following factors when choosing a specialty provider? And this we did hear from previous surveys that certainly distance is an issue, availability of appointments. So we did base some of these on existing data. But Are there other factors that influence how you choose a specialist? We'd love to include more options to this question.
Someone suggested whether they're a disease-specific center of excellence, bedside manner and communication skills, and the knowledge of provider or reputation. These are great suggestions. How long a person has to wait for an appointment, not always aware we had a choice, so that will be important to look at as well, what choices families have. These are all great suggestions.
Excellent. Okay, moving on to the next topic area, which is finding support. We all know from our personal experiences that finding the right type of support is important, but there are all different kinds of support organizations and support services these days. So the first question that we are suggesting is, how did you get connected to a support person or group? We did have previous data from one of our former surveys to individuals with genetic conditions that reported that only about 1/3 of individuals have been referred to support by their provider. So what we'd like to know is how are people getting to support? And I think a lot of the support and advocacy groups on the call probably do collect some of this data about how people found them. So we'd love to hear whether there are any other methods of referral that you think are popular with your members, or if you're a healthcare provider or a public health professional, where you think people are getting connected.
Great, so some of the submissions we've had from a newspaper article, that's really good information. Genetic counselor gave the phone number, preschool teacher of their child from their school, speech therapist, social media, magazine they found in the doctor's office. Great.
Excellent, excellent. And I do want to stress too, these questions that we're proposing, we also want to hear other questions in the evaluation after the call that you think are missing, areas that you think need to be covered to make concrete choices about the future of this regional genetic services model. So the next finding support question that we developed based upon previous survey data is, what types of support or information do you receive from a support group? We had actually asked previously this question, but we thought if there is a regional care network that potentially could act as a resource center as one of many options, we want to know what types of resources families need most. Continuing along to the next topic area, which is finding information. How do families or caregivers find information? So the first question we're suggesting is, what types of information have you had trouble finding? This sounds like a basic question, but it's also one where I think it widely varies for families. Certainly this is impacted by their access to technology, health literacy, whether they're connected to support groups, the quality of their provider, their language barriers. We've heard all of those things, but as a baseline, we'd love to find out more about how people are actually accessing information and where they're having trouble. The next topic area is accessing care, services, and support. The first question we're suggesting is, what is your biggest barrier in accessing genetic services? Distance, cost, availability of appointment, lack of referral, lack of time, don't know what you need, you don't know where to find it, a lack of providers you trust, and don't know. And we did pull some of these answers from a previous survey, but we would love to hear from this group, are there other major barriers you have experienced or the families you work with have experienced related to accessing genetic services? And we do hope that some of this data from the survey, and please inform us to help us make a survey that's useful to you and your members, can be used in your work, your advocacy work, in how you make the case for referral to support, how you make the case for inclusion of educational materials or resources, and also to give a sense of funding priorities at the state and national level. The next area in accessing services is during the past 12 months, how hard was it to access the following services or supplies? And we have asked similar questions in previous surveys, but we really want to get a sense of the ease over time, actually, of accessing these types of services. So we have some previous data as well that we can compare these to. And we know, in particular for this slide, that this can vary greatly based upon the type of condition. And this is where, again, we think it's very important that we get a wide cross-section of genetic conditions. The next question in this topic is, what was the biggest barrier to receiving these services? Insurance coverage, distance to receive services, availability, lack of referral, lack of quality, time to approval, or there were no barriers. And so we were where people said that on the previous slide accessing these services was difficult. We want to find out why. And so are there other big barriers, and I'm going to switch back to this prior slide, that may impact this large list of areas of service that you would like included?
Feel free to keep sending your thoughts in via the chat box, and I will read out anything we get. And then we'll also keep in mind, I know we're kind of blowing through these right now, but there will be opportunities immediately after the webinar to provide feedback, and also upon receiving the next version of the draft survey.
Okay. The next survey, this is a live poll, so the question will come up on your screen. And the question is, what is the minimum amount of travel time that constitutes a significant burden for families? And this question relates to a question that we're going to ask, specifically figuring out how much travel time people do have in reality to access genetic services. And we want to be able to kind of lump these answers in a meaningful way. So we'd love to hear from you what you think the cutoff and important cutoffs are for burden. Okay, it looks like we're over 50%, so we're going to close the poll. And most people selected 2 to 3 hours, but as we can see, there is quite a range there. And we know that these are for different types of services as well, routine care versus a specialty appointment. And so it looks like we actually have a good spread here. Great. The next question in accessing care is about what distance solutions would you be interested in? So what solutions would you suggest to minimize the distance and time burden to receiving care? And we really want to hear from families what they think. Certainly telehealth is one that is suggested, but we want to also assess whether that's the preferred method for individuals. The current choices are telehealth with your PCP, telehealth visit with the genetic service provider, a longer drive to a genetic specialist center where you could receive comprehensive care, or a clinic day for my or my child's condition. And these are all solutions we've heard in the past proposed. One of the questions we have, though, is the term telehealth a term that we should be using in this survey? And if not, how would you phrase those suggestions so that it encompassed telehealth? So first, do you think families will know this term? And this is a live poll on your screen. Great, and that one seems very conclusive, which is that they aren't familiar with that term. So we'd love to hear from you in the chat box how you would phrase that, how you phrase it in other surveys, how you phrase it when you're explaining telehealth to family members. And we're looking for something short that families will understand, but it can also fit as a survey answer. Okay. Moving on to the next accessing care slide. The next question we're suggesting is, which of the following support services would you find most helpful in navigating you or your child's care? And this is directly to the idea of, are there needed resources that could be served by a regional genetic services model? So you can see it's a range of options on making appointments, appointment reminders, virtual or emotional support and guidance, in person. And this is a question certainly that we encourage people to give suggestions on because this is, there's a huge range of support services that are currently available, and even connecting people to those services would be very valuable. The next accessing care questions are around patient navigators or care coordinators. We have heard from previous surveys that this is something that would be useful, but there's a lot of unanswered questions on what that individual would do and what type of individual would be engaged in that role. So the first question we're proposing is, if a navigator or care coordinator was available, which type would you think would be most useful? And to rank those. A fellow parent, a care coordinator within your physician's office, within an insurance company, a support or advocacy organization recommended by the clinic, just a listing of available services, or a telephone helpline. If there are other models that you're aware of, we'd love to hear about them. Similarly, we want to ask the question about what would help people navigate the system. And so the next question is, assuming your insurance remains the same, what would help you navigate the current system better? And we'd love more options on this question. In fact, if people could type suggestions in the chat box for this on the right-hand side of their screen. Some of the suggestions we currently have are a tool to make appeals make them more easier to submit, someone to help explain the appeals process, better comparisons and information on quality of care. But I think there's a lot more options here on the types of supports and navigation that people could use.
Great, and some of the suggestions we've gotten from the audience include a fellow parent in my physician's office, a list of available services, a care coordination specialist or care coordinator in the physician's office or in the hospital. We're getting multiple suggestions for within the physician's office. more quality information, medical social workers, someone from a public health genetics program, a flow chart online that they could complete, 24-hour hotline for anxiety and direction, and a team approach, including care coordination.
Great, excellent. These are all excellent suggestions, and definitely keep them coming. Okay, the next area in navigating the current system, the question is, assuming your insurance remains the same. Oh, this is actually the same on the previous slide. The next topic area is adult care. What are the biggest issues you or your child face around finding adult care for a genetic condition? So this is a multi-pronged question, and we're actually looking to better develop questions for this section. We will ask individuals on the survey their birth year, but we won't be able to, because of the type of question that is, to skip logic and only ask this of some people. So essentially we'll be asking a question both about kind of transition to adult care, but also adult conditions. So we love to find out a little bit more about the topic areas that we could ask questions in this adult care topic. Certainly transition, but please think hard about what concrete actionable data we could collect that could guide the development of a resource model.
And we did get the suggestion to consider breaking out transition separately from this section. So please send your suggestions of what should be included in the survey around transition, and then also around adult care services. So some of the suggestions we did get were independent living, and that is not a nursing home, finding a doctor who can see adults and it is knowledgeable about the condition, the cost, so maybe changes in insurance as the child gets older, comfort with genetic conditions, topics including medication management, finding a job, access and eligibility, and that the eligibility narrows, the criteria narrows, transportation. These are great suggestions. Keep them coming. We got one comment that said distance to adult providers is also an issue here. So maybe that the distance is impacted even greater when you're going to an adult provider.
Okay, excellent. So the next topic area that we felt was incredibly important is beyond the clinician's office. We know that most care actually occurs outside of the healthcare setting. Most care occurs at home or in the school or in the daily lives of individuals. And so this is an incredibly important area that we want to find out where people need support. One of those areas, though, is also around research. And so we are looking at a couple of questions around participation in registries, both for healthcare purposes, referral services, but also for research. So one of the questions we had suggested is what factors impact your decision to participate in a registry the most, and we will be specifically defining the term registry. And we'll also be including questions about privacy in this section as well. But we'd love to hear from you of other areas kind of beyond the clinician's office. We already heard a little bit about kind of support and accessing services, but what other areas do you think specifically a regional genetics care model or regional genetic services model could address? And I know this is one that will take some thought, so if you have immediate ideas now, great, but also please send us questions for this section or suggestions in the follow-up survey. So that's all of the current questions that we're considering. Obviously, it's very important to us to keep the survey in manageable length. So we'll be taking all of the suggestions from this call and from some of our partner engagement, putting them together, and then reissuing that survey, a draft survey, out to everyone for final feedback. So this is not your last chance to participate. Please, as I mentioned, complete the webinar evaluation, or you can send your thoughts directly to us. Sharon Rumelchek, who had joined me on the call, has her information on this slide. And also, we will be engaging our Genetic Alliance Family Advocates Network, which is an online Google listserv, discussion listserv, that you can participate specifically around this topic. And you can sign up for that listserv at geneticalliance.org /about/mailing list. And this is for families, individuals and families, or advocacy or support group leaders who want to participate around this discussion. And this was launched actually in the last couple months. As I mentioned, the next steps are to provide for you your review and updated draft of the needs assessment. And then we'd invite you and welcome you to help us collect valuable national data by disseminating this final needs assessment to your members and the families that you work with. And that's expected in September 2015. This is kind of our community's chance to inform the future funding and services model of HRSA. And so we want to make sure that all voices are heard. So with that, I want to thank you all for joining us. We really, really appreciate your engagement on this. We know that we're asking for a lot of feedback. That's because we want this survey to meet the needs of your members and your organizations and your practices, so that this data can truly be used for this purpose to inform this regional services model, but also so that this data can be used in your work. So if there are other ways that you'd like to engage with Genetic Alliance around kind of this type of data collection or other activities, please don't hesitate to reach out to us. So with that, we'll close out the webinar. Thank you so much for joining us, and we look forward to hearing from you on future webinars.